Hello everyone, Dr. John Bartemus here today with another functional medicine Charlotte patient, Kristen, and Kristen wants to tell us about why she first came in for care. So what first drove you to functional medicine care?
First drove me to come in for care was I had really bad headaches. I would have headaches almost every single day. On top of the headaches, I had extreme anxiety. Like my anxiety was physically crippling at times. And I also was diagnosed with polycystic ovarian syndrome, and so I had a lot of symptoms that correlated with that.
And tell us about, so that's PCOS for short. The PCOS symptoms would be what?
My cycles were very irregular, like usually between 45 to 60 days, sometimes even more than that.
Okay.
I had a lot of acne that started developing the last year. Like after I turned 31, I started getting acne. I just didn't have any energy. I felt drained all the time, which I was told was a symptom of PCOS as well.
Okay, so tell us a bit about the anxiety. Like it knocked you out. What was that like?
My anxiety it really controlled my life. Like it at times would be so bad that I felt like I would faint. Like I would have a heavy just feeling on my chest, like I couldn't take deep breaths, and I would start to see spots, and it was like to the point where I would almost faint, but then I would come back to, and I would be able to have my vision again, but it took away my vision. Everything just went black.
So were there medications involved with that?
Yes, I went to 2 different family doctors, and I went to an internal medicine doctor and kind of let all 3 of them just run a whole gamut of tests on me. They tried to prescribe me antidepressants. All 3 of them prescribed me some kind of benzo, like Xanax or Valium. And that did help with the anxiety, but it was an everyday thing.
Yeah.
Even little things like trying to go to sleep, like sleep was a big issue. Like I could not fall asleep at night, and I would be so tired, but I couldn't fall asleep.
Okay.
I would just
So that's frustrating.
think about things. Yeah, very frustrating. And it would get really bad for no specific reason, like going to work. Mm-hmm. I would start to see spots and get all worked up for no reason.
Okay.
So.
And were there headaches tied to those times?
Headaches seemed like I woke up every day with headaches,
Okay.
so I thought it was just because I wasn't sleeping enough.
Gotcha.
But it didn't necessarily happen, but it seemed like every day I would wake up with a headache.
Okay. And then in terms of the acne, I know there's lots of strategies out there, and dermatologists and lotions and all of that. What did you try for that?
Every lotion, potion, skin peel, anything that I could do. Anything that I could do. I've spent thousands of dollars on skincare stuff trying to get that fixed. I started, after I came off birth control, the acne kind of came to the surface. Mm-hmm. And I had been on birth control for years, so coming off birth control and going to the dermatologist is kind of what started me on the path to get diagnosed with the PCOS. Mm-hmm. But birth control was the only thing that kept it under control. No kind of acne medication creams, no skin peels, no. I mean, I had the chemical peels done, I had everything, nothing.
So is it safe to say you wanted to find a solution for the anxiety and for the acne, but a non-drug solution, something that you want to be on medication every day?
Exactly. You can't, take birth control every single day for the rest of your life, and that's essentially what they were telling me to do to fix the acne.
Yeah. Okay, so what did you experience, what was different about functional medicine care and the solutions we provided versus that other model?
Well, with functional medicine, it wasn't anything applied topically. There was something wrong inside of me. Mm-hmm. So addressing the cause, whatever was causing the acne, taking care of that, mm-hmm. Something internal is what fixed it.
Good. So with care, and it's probably been 6 months?
A little longer than that, I think about 8.
Okay. 8 months of care, and what have you experienced as it relates to all those complaints?
Well, my anxiety is pretty much non-existent. Like, it used to be such a big part of my life. Like, honestly, like, I would not leave my house without knowing that I had like a Xanax in my purse or in my wallet or wherever on me, because it would be so bad that like I would have to leave where I was if I didn't, you know, have one of those like fainting episodes in public. So, I mean, it was such a big part of my life that's like completely gone now. I mean, I still get flustered, I guess, like a normal person, but I don't have any physical symptoms.
And you're not taking any
No,
benzos?
nothing.
Okay.
Nothing.
And the headaches?
The headaches are pretty much gone. I mean, like, rarely I have a headache to where it was something that I had almost every day.
And today, the acne?
Yeah, I mean, like, some days are better than others,
Yeah.
but I feel like it's 80 to 90% better.
Awesome.
Yeah.
And what about as regards to your cycles?
Well, from being so far apart, I typically get my cycle now every 30 days or so, and I have for the last several months.
Awesome. So what we can see is with Kristen, when we use the functional medicine paradigm to get to the causes of what's going on, all of these symptoms that seem unrelated and that require 3 or 4 different doctors to deal with 3 or 4 different pills, using the functional medicine paradigm, we can say what's the cause and address the causes in a prioritized fashion as it relates to the individual, not the diagnosis, and we see these things clear up. So first of all, excellent job, Kristen, because we can find the cause, but the patient has to actually be a good implementer and do the work, so she's done that. And what would you say to anyone on the fence who's maybe like wants help but is scared or doesn't know what to do?
I would say definitely check into functional medicine, because I have spent so much money and so many years just being miserable when I corrected all these problems in 8 months.
Yeah, awesome. Well, Kristen, thank you for your time and keep up the great work.
Thank you.
Yep. Have a great day.